I'm Dan from DermEngine, and my job is to make sure that skin doctors can have the easiest workflows to do a skin check and to provide more patient information and then do more skin checks, because we do have the burden of skin cancer in Australia. 2 out of 3 Australians will get skin cancer before the age of 70. So my role is to help doctors reduce unnecessary biopsies and then also reduce the number of false positives using our skin cancer management platform. So we have the Molescope as a product, then we also have DermEngine as the software. So we're agnostic in terms of the dermatoscopes that you can use. You can use a DermLite, you can use a Heine, whereas DermEngine is a cloud-based skin cancer management platform. And you would take images on your phone that are then transferred to the cloud, and then those images will come on your screen. You can talk to the patient about the characteristics of your lesion, about the characteristics of the mole, if it's changing, evolving, talk to them about the borders, the color, and then if you were to do an excision, you also then get to send that image through to the pathologist. And the benefit of the pathologist having an image of the dermoscopic image is that they can then have a common ground to talk to. So, unfortunately in the industry we have things which are called false negatives. So it's where the pathologist will actually take microscopic layers and look at the wrong area of the lesion that wasn't malignant, whereas you can go back as the GP and ask them to do more layers. So our platform manages that whole workflow cycle from capturing the image, whether the patient captures that image, the GP captures the image, the nurse captures the image, that image is then sent off to the pathologist, and then those reports are pulled back into DermEngine. So we give you reports on how good you are at diagnosing pigmented lesions, how good you are at diagnosing non-pigmented lesions. And ultimately then, if you did find a patient that was high risk, we also allow the facilities to do total body photography, just from the power of the mobile phone. GPs spend a lot of time taking image on their phone to then email it to their receptionist, and to put it into the practice management system. So streamlining the workflow of the skin check so the GP can come in, point and shoot, take a dermoscopic image. Recalls, patient comes in, you've got those images on file. We use artificial intelligence to have a look at the image you're taking today, compare it with the image you took a few weeks ago, a month ago, a year ago, and to let you know if it has changed. And then from that point, creating a nice report for the patient to potentially take to the plastic surgeon if the lesion's in an area where the GP isn't comfortable excising, or for then the image to be sent off to pathologists if the GP is doing the excision, and then all that information being stored in one place. We have a learning management system called the DermEngine Academy. We have nurse practitioners who do training, whether that's via webinar or face-to-face. There is no upfront cost when you're getting DermEngine up and running. We provide you login details. It's all done over the internet. We will log into your server environment as well and integrate your practice management system with DermEngine. With regards to getting up and running, you can sign up today and you can be imaging in the afternoon. But there is a platform and it is quite comprehensive. So making sure that you're doing dermoscopic images in the best way possible, because you can do a skin check in so many different ways, is making sure that you can map that DermEngine workflow to your skin check workflow. So that will take probably about a month to upskill yourself in, and then whether or not you want to integrate pathology or not, those are things that we can attack further down the path. We don't have a typical customer. Our first client in Australia was the Melanoma Institute of Australia. So we have dermatologists using DermEngine, then we have their nurses doing total body photography. We have the Helios clinics using DermEngine. We have Fullerton clinics using DermEngine. We have the Sun Doctors clinics using DermEngine. So anywhere from your standard GP who's just doing a skin check every now and again and wants something to document, to a pathologist, or to a dermatologist who's looking at skin every day. That's our ideal customer. So doctors get paid to excise something. If it isn't malignant, there is a cost to the patient, and then some doctors feel guilty about charging that patient, or the patient if they've got a biopsy result back and it is benign, and now you're asking them to pay for an excision that they didn't need, there's an awkward conversation that's had there. Where we've helped practices is changing their workflow around skin checks. So you can image a lesion, and the benefit of skin cancer is it's not going to kill you straight away. you can get the patient in 12 weeks time, you can track change to then verify that you would like to excise. So it's instead of excising, if in doubt, cut it out, it's more of we can get you back in and you can charge the patient, or you can bill Medicare twice for making sure that you're keeping the patient care in mind. So you don't want unnecessary biopsies. You're reducing that patient harm and you're still keeping that patient the patient consults coming in. DermEngine definitely is there as a tool to enhance the doctor's workflow. We want you to find more skin cancers. Australia has the burden of skin cancer. 2 out of 3 Australians will be diagnosed with skin cancer before the age of 70. So the skin cancer is out there, and we're trying to give you a tool to find that skin cancer so you can excise the malignant lesions and leave the benign ones. So my advice to GPs who are looking to specialise in skin is that the barrier to entry for specialising in skin is very low. There's software out there like DermEngine that there's no upfront costs, and you can start imaging straight away. You can then access our academy, you can access the health certs academies as well, you can do online training, and you can upskill quite fast to then provide a valuable service to the Australian population. So probably now is better than ever to get into skin cancer, especially post-COVID, because we've seen a drop in the melanoma notifications, and so unfortunately that will mean that we're getting an increase in melanoma notifications at a later stage. The skin cancer doesn't go away because of a pandemic, it's just that people haven't been seeing their doctor.